Today is Friday, May 1st, May Day, for those of you celebrating, and welcome to today's daily COVID-19 Task Force update. I'm Joe Delarone. Joining us on the program today will be Lisa Westaway and Lloyd Phillips, but we're going to start off today with an update from an organization that we haven't had on the program before, and we're very pleased to invite and welcome Lisa Phillips, the Executive Director at the Kahnawake Language and Cultural Center. Welcome along, Lisa. How are you doing?
Well, I'm doing well. Yourself?
Not too bad. This has been, we've said this over and over, challenging times for everyone. And for KOR, it's been a little more challenging because we just came out of April, which was supposed to be Cultural Awareness Month. We'll talk a little bit about that, but you have been keeping busy, so maybe if you can just tell us what's been keeping you busiest in the last little while.
Well, yeah, the staff at KOR has been extremely busy. We're not working in the building, but we are all working remotely from home. I think one of the most challenging and time-consuming parts of the work that we're doing has to do with the Kahnawake program and being able to provide language learning through distance learning with the students. So that's taken up quite a lot of time. I have to commend our teachers. We have excellent teachers, and from the minute that we told the students that they would go home, and when we suspended the classes, that didn't mean that the classes ended per se. They just started to be done remotely. So our teachers are working very, very hard, and the support staff as well for the program. And so for there, the challenge has been for the teachers to learn, in the moment, how to teach using the distance learning, providing the lessons to the students. So they're learning along with the student while trying to teach the students. So they've been putting in a lot of hours, long days, and I really have to commend them. They're doing an awesome job. So that's been one of the things, and our staff has been working very hard, the entire staff. Our board of directors as well. I'm in constant communication with the board of directors of KOR, and we meet weekly. The staff as well meets weekly, and there's constant communication, daily communication between myself and all of the staff. So we're working very, very hard.
I wanted to get back to the classes, because you talked about how the teachers have adapted. What's it been like for the students? What have they been telling you about how the classes are being conducted? How effective are they?
Yeah, we, at the beginning, I think we were about maybe 2.5 weeks in when we suspended classes on site. The teachers put together a questionnaire online through Google Classrooms for the students to answer what it is that what their expectations were, what they were able to commit to the program, what was realistic for them during this time. And we got a very good response. In meeting with the teachers and the work that's being done, the students are retaining what's being taught to them. But one thing that we have to say and that we recognized early on is that the quality of the teaching and the quality of the learning and of the proficiency of the students is going to be quite different from what it would have been had they been on site in the classroom working together.
What about the, usually I guess at this time of the year you're already looking toward the end of the season, so to speak, and graduation and all that. So what happens with it this time around?
A few weeks back, I think it was April 3rd, we had a board meeting, and there was quite a lot of discussion leading up to that meeting. What we do is, or what I do is I meet with the staff, like I said, all of the time, and I meet with the teachers So in anticipation of board meetings and certain topics that have to be discussed, I will meet with the teachers and we will discuss the list of items or topics that I'm going to discuss with the board that require decisions so that the teachers have input and I'm their voice when I speak to the board. So for us at KOR and with Radio Mananirdat's program, we had to make a decision. We had to make some decisions. For the most part, the students were participating in the online work that was being done. A lot of it was worksheets, but there was still work that was being provided to them. But we had to make a decision. So we made a decision and that was sent to the students via a memo. And we haven't received any feedback from that or any complaints or any issues. But what the decision was at the board level was that the students that we have, because we do have two classes, right? Year 1 and year 2. So year 2 students that we have are set to graduate June, and they are going to graduate. So the decision was that the teachers have been working very, very hard, very diligently to provide the language learning through them, through online and through distance learning, and that the students have to participate. Participation was mandatory for the students, and that in order to move on for the year 1 students to move into the second year and for the second year students to graduate, that participation was mandatory. They won't be marked necessarily on the work that they're doing, but it would be based on participation. And should there be non-participation, then it would be seen as the students did not complete the program. So everything's been moving smoothly then, but we did have to make that decision. We had to say, because if there's an option, you can do this or not do this. Most of the time, the reality is that people will choose not to. So we had to make those decisions moving forward.
All right, and speaking of decisions, April is usually an extremely busy month because of the Cultural Awareness Month.
Yeah.
Of course, things had to change. Give us maybe a brief recap of how that went.
Okay, so what happened was initially when the pandemic started, and there were a lot of unknowns, variables at the time. So the decision was made, and it was a hard decision to make, but it was made that we would cancel Cultural Awareness Month. So, as more information came in and we got a little bit of a better idea of how long we were in this for, or that we were in this for longer than originally thought. Again, in one of our weekly meetings with the board of directors and myself, the decision was made that although we had decided to cancel Cultural Awareness Month, that looking at what was going on in the community, with the quarantine talent and the scary stories, Kahnawake, and the photo shares and those types of things that really seemed to engage the interest of the community, and the community seemed to want to do that. They had interest in that KOR would do a virtual Cultural Awareness Month. So for the entire month of April, we did a virtual Cultural Awareness Month, and every week a calendar was put out on social media. So a lot of the work that was done, and we have an excellent staff. We have some new employees, within the past year. One is Shay Sky, the other one is Scott Berwick, and then we have Corey Phillips as well. And so they worked very diligently on putting together the schedules and the calendars and to put out. Of course, we had to pull from our reserves, our libraries. And so what we chose, a lot of the topics that were chosen were based on the interest that we were seeing in the community towards environment, planting, our medicines. So we offered, during Cultural Awareness Month, we had 4 previously recorded cultural awareness presentations from the past. The history of Kahnawake, branching out trees and medicines with Chuck Barnett and Daryl Thompson, environmental education, which was Gunnerat Hemlock and Raven Swamp. We did Thunderwater and the rise of modern Rudinasuni nationalism. So those were the topics that were picked. We also had 13 videos of elders, interviews that were done all in Ongwehueneha. And then also we had a Rock Your Mocks kids contest for children's vamps. And so also within that, we also had the photo archives, which Scott Berwick works on. And he had, in collaboration, had also done a video highlighting the photo archives to, you know, the project and the work that's being done. And that was called Zinio Dumne. And that was a song that was sung by one of our past graduates, Anhagan Hodu Norton, that was written by his brother, who is one of our Radiwana Nirdat teachers, Roni Gugatste, in honor of their grandmother, who is our first language speaker, Helen Norton. So that's a beautiful 3-minute video. And we've been doing a lot of work. The staff has been doing a lot of work. And, you know, we've had Duda Danawagwardi and Zita. Everybody's been very productive with Guanahu and Kiana Cross and with Guanazidawi Phillips. They've been continuously working from home remotely, and they've done production of screensavers and wallpapers. I have one on my phone of Duda. I know, I think it's Sohare telling us to wash our hands, you know, looking at what's on. So we've been doing a lot of things. And then there's also been the day, which is through the Language and Culture Network and the Language and Culture Center of MCK. So we've all been working together. Mondays was Rock Your Mocks. Fridays, again, as in past years past, was traditional clothing. So we've been extremely busy. And then moving forward, even though Cultural Awareness Month is now over, we're May 1st, we're still going to continue to work towards providing some more language and culture content to the community. One thing that's of interest that some people might be interested in, can keep their eyes open for, is Gerald Reed is going to be offering a live Zoom presentation on May 14th. And that's the topic for that is beadwork and border crossing, Kahnawake craft workers in the Jay Treaty in the late 19th century. And that's going to be a Zoom interactive presentation that he's going to be doing, that Shay's been working on with him, because he would like to interact with the community to help with some of his research. So that's revolving around beadwork. Wow. So we've been extremely busy. Everybody's been busy, and I'm so proud of our staff. I'm proud of our board of directors. It's been hard, you know, adjusting the adjustments, but the work is being done, and we're very busy even now in terms of admin. You know, we're undergoing or prepping for our audit, which starts Monday. You know, so our financial person, Fawn Deer, has been working very hard, long hours, prepping for the audit. We want to continue the work, and so that once we do get back, you know, on site into our building, that we can just continue moving forward.
All right. Well, you obviously
it's a lot. It's a lot.
Now you get to the fun part, the audit. So
yeah, yeah, the audit.
Yeah. Well, obviously you've been very busy, so hopefully you take the weekend to rest a little bit and get right back at it on Monday. Take care, and thank you so much for joining us, Lisa.
Yeah, we'll go.
All right, take care.
Ana.
Lisa Phillips, the Executive Director of Kahnawake Ongwanadaw Language and Cultural Center. Speaking of Lisas, we have another Lisa coming up, and she's here almost every day, and with her daily report, Lisa Westaway, Executive Director, Cattery Memorial Hospital Center. Lisa?
Good afternoon. A few updates today. Firstly, I'd like to talk about the testing site. It's going really well. We've had about 210 calls over the 2 days. Many people are answering the phone, so thank you very much. In fact, because of these calls, we've performed 21 tests. So we didn't have to go to people's homes, and we're glad about that. People are able to be tested the same day of the call. They're coming in and being tested. So what does this tell me? It tells me that there are many people with symptoms that are just unsure or not, you know, they don't want to call us, but by reaching out, it's making a difference. So we're going to continue to do that. We also have a website set up for those who don't have a landline, so that you can send us your contact information. The website is healthcheck@kmhc.ca. Many people are sending us their cell numbers, or they're calling us at the appointment, the testing site, to be able to give us their phone numbers. So either way, you can email it in or you can call. And so this is going really well, and we're going to continue to do this. Hopefully, we'll be able to reach most community members over the next 10 days or so. That's the goal, anyways. So we continue to test, and we continue to see what's happening in the community. When I do have an update and I have many more results, I'll be able to show you a table that will give you a bit of an idea of what's happening. So one thing I wanted to speak about also is Quebec, a little bit about what's happening in Quebec. So we see that schools are potentially reopening. We are not sure, because we also see many school boards who are contesting this fact. But for now, the schools are reopening. And as a result of this, Quebec is implementing some measures that will allow them to better control, or hopefully better control what's happening. And one of those things is an increase in testing capacity. So they've announced today that they will be increasing their testing capacity to about 14,000 tests per day as of Friday. We find that a bit we're not sure how that's going to happen. We know that there's a shortage of materials across Quebec, but that's their plan, is to increase that testing ability. Why are they doing that is really for a simple reason. We've seen through all of the research in European countries who are a bit ahead of us in the reopening process, we see that one of the main criteria for success is the ability to test quickly, get results quickly, and to continue to self-isolate. We also see that another area that is especially important is to continue to limit gatherings. Unfortunately, what was mentioned today in Quebec, in the Quebec press conference by Arruda, by the head of public health, is also that they feel that they may be heading towards a loss of control. And that's the reason for that, is that the population is not following directives for self-isolation. There are gatherings. Why am I bringing this up? I bring it up because as Quebec is mentioning reopening, and as we kind of get a feeling of complacency, we're seeing that measures are also not always being respected here in Kahnawake with respect to gatherings and self-isolation, or social distancing, I should say, is more specifically. So especially when the weather is nice, we're outside more often, and that's fine. We're good with that. That's okay. But we have to keep our 2 meter, 6 foot distance at all times from people who are not living in our immediate household. And we're noticing that that's happening less and less. So if we've decided not to open schools, and we've decided not to reopen business. So you're probably asking yourselves, why is that the case? Why are they opening in Quebec? Why are we not doing this here? I know Lloyd has spoken about it often. We've spoken about it here, about the fact that our community is different. But just in general, I'd like to give you a few facts so that you have the information. So what we're seeing as of today, and it's been happening progressively ever since Quebec has mentioned that they're loosening up on rules and that they're reopening, is that there's actually an increase in number of cases. There's actually an increase in number of deaths. This has been predicted by Quebec, but I think it's what was stated today, so what is a reality, is that the increase is much more than what they expected. What we're also seeing is that hospital beds, we're starting to see limitations in hospital beds. It's problematic. There's been an increase in the number of beds required. People are staying in those beds longer, and therefore we're starting to see an impact to that. And we're looking at what we can do as a province to ensure that we have enough hospital beds moving forward. Another fact, we're seeing major outbreaks in 3 Montreal hospitals. We're continuing to see an increase in death in long-term care facilities. Again, we've mentioned, so these are all things that are happening around us, which reconfirm to us our decision to maintain the course, to maintain our directives, to not move forward with loosening up on the rules. And again, when you combine all of that information with the fact that our community is different, that we are more close-knit, that we are closer to our families, that we protect our elders. I could go on and on and on about how we are different, and you know more than I do. When we combine all of these elements together, we we believe even more strongly in the decisions that we've made. So again, I think it's important just to note that as a task force, we make really difficult decisions on behalf of the community, and we don't do that without the full knowledge of the impact that this has on people's mental health, psychological well-being, financial well-being, physical well-being. They're very, very difficult decisions that we make on a daily basis, but we make these decisions based on certain guiding principles that I would like to remind you of. Number one, our goal is to protect our elders. We want to protect our vulnerable community members, and we want to protect lives. We make these decisions at the expense of other elements, but our decisions are based on these points. And it's important to understand that those guiding principles guide every decision we make so that you have a better understanding of why we make the decisions that we do. So for those who are suffering for any of the, for any reason, we urge you to use the services that are at your disposal on our websites. I won't go through them today, but they're available to you, or that you reach out to a loved one who can maybe help you through the suffering that you're going through. And I really urge you to continue with the measures of physical distancing, of of self-isolation when you have symptoms. Those are key elements of going to be tested when you have symptoms. These are all key elements that will get us through this. So I'm going to let Lloyd come to speak to you about some more on the more positive side, because we are, despite where we're at today, and despite the fact that we are staying put and staying the course, we are also planning for the future. So it's really, Lloyd's going to give you a bit of information about where we're at in the planning process in moving forward. So we can finish off with the positive. But again, I urge you to continue what you're doing. It's really, really important. Thank you.
Thank you, Lisa. Well, I'll start off by this maybe talking about something that's not as positive, first and foremost. No, just looking at some numbers before I came on air here, and you look at April 1st. April 1st, there was only 36 deaths in Quebec from COVID-19. And now there's 2,000, just over 2,020 deaths. So just about 2,000 people have died in the province of Quebec from COVID-19 in the past month. And just 10 days ago, that was at 1,000. So in just 10 days, the number of deaths have doubled. And so these are some of the numbers that we always keep watching. As you said before, those are numbers that we really care about. And in Kahnawake, we're doing well. I said, but the more and more these deaths and cases keep rising, the higher and higher the probability of something impacting directly on our community. That's why, as Lisa mentioned, we discussed it again about various directives and various measures, and we feel it is time to maintain the course, maintain what we're doing, because what we are doing is working. And I have a graph I'm going to show in a little while on that explains a little bit more. But I just wanted to re-emphasize that, because we are planning, and we are planning for the future. But at the same time, we're planning for the future. We can't forget the fact that we are still in a pandemic, and the measures that we're putting in place, we're putting there to protect our community, and that's what we have to keep on doing. I know some people may find it a little arbitrary at times, and why this little thing and why that little thing, but no, everything is linked, and we play out the various scenarios, and if we allow certain things, how would that impact on other areas, and it's much easier to maintain the line and be consistent throughout. It's not to pick on any individual business or any individual person. It's a matter of trying to be consistent as we possibly can. And believe me, it's certainly been a challenge with all the multiple different factors here within our community. So with that planning for the reopening, as what Lisa mentioned, we don't want people to feel that complacency. Oh well, we're through the pandemic, because we're planning for the future. to the contrary, if we don't stick to the measures and things start to go off the rails, as I mentioned before, and then the reopening of Kahnawake may be further delayed. So now is the time, to really buckle down and make sure that we stay the course as strong as we can, so we can get to that finish line, as fast as we possibly can. What we adopted today as a task force under the recommendations from our Kahnawake revitalization plan, economic revitalization plan, is a matrix on businesses. We had identified 24 different industries in the community, and each one of them will be plotted onto a matrix, based on health first and foremost. What's the health risk to the community if this industry opens up, and versus economic impact, and several other factors. But the main ones are the economic impact on the community, how many people do they employ, and things of that nature. But as well as on another plane to say how much health risk there is in the community. And we're going to have a group next week that's going to be plotted out on this matrix, where each industry, not business per business, but where each industry falls within this matrix, and that will come back to the task force for discussion next week. And at which time, once the matrix and the phases are clearly identified, obviously we'll be sharing that information with the community as soon as that is ready. And along those lines, that helps with Dewa Zakta, who is going to be, has already started, but we'll be reaching out to all these industries and assisting them on how to get back in operation, informing them on what's there to assist them, and working with them on developing guidelines on how their business can operate in a safe manner. And as well as, obviously, the task force has that responsibility to ensure that the proper safety and health guidelines are followed. So there'll be a collaboration there where Dewa Zakta is going to be working directly with the business and the industries, and we'll be supplying the information on the health and safety side. So there is a lot of things happening. There's a lot of work being done. So I just want to reassure the community that that plan is being put together, and I'm looking forward to sharing that with the community as soon as we possibly can. Regarding the couple of decisions that were made today, we talked about the schools. As we know, Kahnawake, the schools are not going to be reopening for this year. There is going to be some elementary schools opening within the province. The education system did do their call out to the parents, got a hold of the vast majority of them, and in which the vast majority of those parents said they had no intention of sending their child to school. That is something that the task force is glad to hear, because we were discussing it, and that was the area we are leaning towards, is making that recommendation not to send your child to school off the territory. And so it was formalized today, where we said that's a formal recommendation from the task force, is that if you do have a child that does attend elementary school outside the community, that you do not send them. Now, further to that, there will be no bus transportation provided for students if you decide to go off the territory. That'll be upon the individuals to find their transportation. Mind you, there's a little caveat there. We understand that there are certain instances where there is special needs and that are required for individual students, and those will be dealt with the education system on a case-by-case basis to ensure that no child is left behind if they need that extra assistance. So those will be done on a case-by-case basis. Just a couple of other points that I want to relay before we get into a little matrix that I want to show you. A couple of concerns were raised by David Scott, the fire chief, also oversees the ambulance service. That they're seeing, on one hand, they're seeing a drop in the number of calls, which is good overall. But at the same time, they're seeing an increase when people do call the ambulance, that they're calling too late, where they really should have called the ambulance much sooner. So even though we had information out there telling people, please, don't call the ambulance for unnecessary reasons, like a minor cut, or just to check your blood pressure, or just to do minor things like that. By all means, if you're feeling like you're having some type of major medical problem, or you have a major injury, or by all means, pick up the phone and call for the ambulance, and they'll be there to respond as quickly as possible. So we don't want to discourage people from calling the ambulance, but we want to encourage people to call when they need it. So just keep that in mind. As well as there was some concerns raised in our discussion this afternoon about it seems to be like an increase in people having gatherings, people having parties in their homes and such, which again is something that is not permitted at this time. Any type of gathering is not supposed to be happening. That's how the virus spreads in and around our community. So it was concerning that we're hearing these stories again. It seemed in the beginning there was these parties in people's homes, for example, and they kind of seem to die down for a while, but now we're hearing stories more and more that it's happening. So again, we don't want to put our peacekeepers at jeopardy. We don't want to put our community at jeopardy. So please think twice before you do that sort of thing at your home. And the peacekeepers, if need be, they do have the right to enter and break up a party. And like we said before, they could issue fines if warranted. So I just want to relay that information to you once again. Maybe now, if you can move to that graphic that we have on the board. This is one that we had found. Actually, we can't take credit for this one. This one was put up. We found this on Facebook, as a matter of fact. But it shows on here, on one side, you see it has new cases, going vertical, and then the horizontal line that says the time. And if you see the red line there, where it says no business as usual. So if you follow that line and say, well, business as usual, obviously you see it goes straight up, and cases, are dramatically increased. And if you see that green line there, it talks about with precautions and precautions and prevention efforts. You can see how the line goes again, and it makes that wave as it looks like. And if you see that line where it says where efforts start working, that's what we've seen over the past while in Kahnawake and even throughout the province, where you see these efforts are starting to work. And you see that line not shooting straight up, that you see it leveling off, you see it starting to peak, you see it starting to go the other way. Well, you have the area in the middle there where it says warning. We're getting very close to people feeling like, it wasn't that bad, and we overreacted. So, and that's basically where we are at this point in time. Measures are working. There is that sign of reaching at that peak, at that curve. We're potentially going to see that downward flow over the next couple of weeks. But we're at that crucial point right now where people may start taking things for granted, and that's why it's a warning to saying, if we do not follow the measures, if we let off the gas, that red line, that green line could turn into that red line and shoot right back up again. So it's very important. At the end of the day, we do what we got to do. We maintain the measures, and yes, it's difficult, but at the end, if somebody says to the task force that we overreacted, I'll take that as a compliment, because at that point in time, that means nobody has died, nobody has been severely sick, and at the end of the day, our community recovered, and our community will recover. I know people are struggling right now, but we will get through this, and once we're on the other side of it, again, I want to be able to look back as a community and be very proud of the response, because the whole country is watching what Kahnawake is doing. And I'm very proud of that, especially First Nations. They wish they had the structure that we had in Kahnawake, and the response that our community had from everybody living in their homes and taking care of themselves, business community, and also the task force and the responsibility that we had taken on. It's a model that I'm very proud of, and that can't be done without you, without the business community and support from everywhere. So thank you very much for that, and I'll leave it there, and I'll see you again soon. Ona.
Thank you very much, Lloyd, and that's very well put. And we really do have to, it's funny, sometimes we come on here and feel like on this program we're being cheerleaders in some way to say, stay the course, but the fact is we have to, and we really do appreciate the cooperation. Earlier this week, our colleague Neil McCumber was on to talk about the survey that was taken and just how many people are actually following the directives and appreciate the work that is being done. So if we can just stay that course and know that as an individual at your home watching or listening to this, you can say to yourself, oh good, I'm not the only one who's trying. There are so many others who are. So stay the course. Remember, when businesses open up around us as well, because they will, probably earlier than here, we have to maintain the course, and we have to keep our measures in place even more diligently. So let's be careful. Let's keep the 6 feet apart, and you know, let's wash our hands and do all of the things that we need to do, and have a good weekend at the same time. So on behalf of everyone here, I'd like to thank Lisa Phillips, Lisa Westaway, and Lloyd Phillips for joining us today. We'd like to thank you for being with us. And tomorrow, Greg Horn is going to be joining us from Yuriweze, talking about the media perspective on how this has unfolded in Kahnawake and how the pandemic has impacted what he is doing. And we're hoping to speak to others in the local media in the days to come. So with that, like I said, have a good weekend. Tomorrow's supposed to be beautiful. Enjoy, but keep your safe distances. And we'll see you tomorrow. Yao ko adano, onigiwai.